Hello, guys. Good evening. Hello, everyone. Good evening. It's Thursday, and we're here for our Facebook Live on Nursing Prioritization Delegation. For tonight, we have prepared several questions for you guys for nursing. Uh, for drugs. So we are going to focus in the next few weeks discussing about drugs because I know that it's one of the most important topics that you want to review for the NCLEX. So we're back, everybody. This is going to be every week. It's going to be Thursday as much as possible. And then also, I'll be giving you the most common drugs for the NCLEX as what I have said. The top 10 medications, maybe. It's going to be every week, everyone. But before anything else, I'll introduce myself. My name is Mr. Alan Matus, and I'm the nursing instructor or the lead faculty for the Matus Nursing Review. I do NCLEX reviews, guys. I'm a nursing instructor for so many years, and then also I published a book for NCLEX Review, and then also I established the Matus Nursing Review online NCLEX Academy, wherein you can do self-study programs. At this time, I'm a nurse educator of a nursing facility of a long-term acute care facility down here in California. And we are based here in Long Beach, California, also, of course. Thank you, Sing Galarosa, for being here tonight. So let's have a shout out a little bit. Okay, thank you. As what I have said, we're gonna have the most important medications that you need for the NCLEX. So we'll be having a pharma review, especially focusing on delegation and prioritization, everyone. Okay, so without further ado, let's look at our slides, everyone, especially on what's on for tonight. So the first one, I would just like to go over our testimonial from one of our students who went to enroll in our online NCLEX review. So our student, I just hide the name. Welcome, Cecilia. Good evening, also. Thank you so much, Sir Alan. I truly appreciate your help. I will definitely utilize the webinar recordings and will try to attend a live class when I'm able. I want to also let you know that I am thoroughly enjoying the self-study online course. Everything is detailed yet on point and super organized. I am recalling past information that I may have forgotten, but at the same time, I am also adding new information. I am following the study plan and everything is going well. The workbook is helpful too as I use it to take notes and it also serves as my reviewer. I'm so happy that my school signed me up for your review course. As you know, guys, I'm working with a nursing program. I'm reviewing nursing students of that nursing program, and I have their students. So far they like the program, and that's really very nice. Also for tonight, just a quick announcement before anything else. We have our 4-day fast track review that's going to be on April 19 and 26, and then also May 3 and 10. So this is a 4-day fast track review. Every Saturday, that will be from 8 a.m. to 4:30 p.m. Pacific time via Zoom. And this is all for US, Philippines, and international RN and PN students. So your course package includes the workbook, which is going to be part of the program, of course. You will have access also to our online self-study and class review course. And also you will have high quality lecture videos. So I do have my recordings online and you definitely can access those recorded lectures. You also have a study plan schedule, you have NCLEX quizzes, and then also the final NCLEX predictor assessment exam. And of course, a lot of videos for prioritization and delegation. And also, if you're from the US, you also get a free copy of my book, which is a simple, fast, and easy NCLEX review book for US students. I published it recently because we have the next generation NCLEX. So I'll be discussing more about the books later on. Hi, Cecilia. How are you doing? Okay, so another one, just an introduction before we continue again. We do have a self-study next gen NCLEX review course online. So if you're very busy and you have no time to study and you really want to have access to online lectures anytime, we have the self-study program, which is amazing. A lot of students really like it, especially that it comes with a 400-page workbook. So if you graduated a long time ago, this is a program for you. It has interactive core content review, all of my recorded lectures, You have the NCLEX Success Workbook, the study plan calendar. You have end of lessons NCLEX quizzes, and of course, we also have there our Facebook Live video recordings. So again, this is a self-study program. And then, of course, our flagship product in our online NCLEX Academy is our NCLEX Success Workbook. So it's a 400-page workbook and the most in-demand item. So it's a workbook that we have for so many years, and a lot of students have been passing the NCLEX because of this workbook. With our NCLEX Success Workbook, you will master your nursing content through straight-to-the-point discussions, extensive note taking, and critical thinking exercises in a simple, fun, and interactive approach. So visit our Facebook page or YouTube page, and you will see all the testimonials of students who have passed the NCLEX really because of the workbook. We are one of the few review programs that offer a workbook during the self-study program, which means to say you're not just watching video guys, you're actually writing down notes while doing the self-study program. So it's more interactive review. And then also we have, yes, so this is the sample of the workbook, the pages. So it has exercises and of course, tables as well, and very simple presentation. So if you read the testimonials again, a lot of students like the workbook. So for tonight, whoever's joining tonight, you're gonna have a chance to win a free 90-day online access NCLEX review. Just make sure that you make a comment so that you could be part of the raffle that we will announce the winner later on. So free 90-day online NCLEX review. You'll be able to access the online academy with all of my recordings, comprehensive review, everyone. Okay. All right. And also, before anything else, I would like you to request, just share or subscribe to our YouTube channel, especially so that other students can also learn from this Facebook Live presentation, everyone. And again, we're focusing on one of the most important topics in the NCLEX, which is your pharmacology or your most common drugs in the NCLEX. And then also watch out for other free lectures that I'm going to be giving. So sign up by our email. I'm going to be doing some test taking strategy um, sessions also via Zoom in our Facebook group. And also, I'll be doing a Zoom as well, wherein we'll be discussing test taking strategies and also rationals. Hi, Udit. Thank you, that. So one of the big things in the NCLEX in your task plan is really the prioritization and delegation. Everyone, your prioritization delegation is really very important. Your next generation NCLEX is part of the NCLEX. However, remember that you will still receive questions on prioritization delegation, and that's really very, very important that you understand how to answer questions on prioritization delegation, especially as well, especially US based practices. Um, I work in the long term acute care hospital right now, and we're doing primary nursing, we're doing team nursing, and you can really see the the delegation part, how the LVN functions, the roles and responsibilities, and also the CNAs together with the registered nurse, and also the coordination with the other healthcare team members as well. Now, also in terms of prioritization, since I work in the acute setting, okay, it's a respiratory acute setting. I see a lot of patients every day, especially also the ability of our staff to really prioritize needs of our patient, especially for change of condition. So that's why prioritization is a big focus in your NCLEX exam, everyone. That's a big one for your NCLEX, your prioritization delegation, because that's the reason why we are all nurses. So, we need to be able to identify problems going on with our patients, and then what's the priority intervention. So let's have the first question for tonight. If you're ready, everyone, we're gonna have the first one. So yes, Odette, welcome for your comment. I know that some other people are going to be watching also later on. You can make a comment as well. Now, based on the Facebook regulations or policy, this video will stay only for 30 days, everyone. So make sure that when you see these videos, you watch right away so that you can make a comment, and then also you can further practice, and then also share with your friends as well, because they might win also the 90-day NCLEX review, which is review programs are very expensive nowadays, so it's a good thing if they have online access. Okay. All right, so we're gonna have the first question for tonight, and let's see if you're able to answer this question. Okay. So number one question is going to be about diazepam. Now, this medication has always been in the NCLEX. So diazepam or Valium for an acute seizure, which is given to the patient. Which findings should be addressed immediately? A, the patient reports drowsiness. B, the patient's respiratory rate is 8 breaths per minute. C, the patient's blood pressure is 110/70. And letter D, the patient feels dizzy when standing. Again, a nurse is monitoring a patient to receive IV diazepam or Valium for an acute seizure. Which findings should be addressed immediately? A, the patient reports drowsiness. B, the patient's respiration is 8 breaths per minute. C, the patient's blood pressure is 110/70. Or D, the patient feels dizzy when standing. So, what do you think is the answer? Now, just remember in the NCLEX that the actual NCLEX questions are not really complicated. They're really just direct to the point. So this is one of the easiest questions that you will probably encounter in your NCLEX. And again, just to let you know, in my online NCLEX Academy, I have many, many, many practice questions on prioritization. And it's really very important. Okay, so bubble gum. Cecilia. Okay, so let's go to the answer right away, guys. The answer is going to be letter what? Without further ado, that would be letter B. Very good, guys. Letter B. So the patient's respiration is 8 breaths per minute. Now, what is the reason for that? Number one, you have to remember that Valium or diazepam is a CNS suppressant. It is a sedative. It is an anxiolytic medication. So with respiratory depression, it is a possibility. So that's why we have to monitor the respiratory rate. Now, your strategy in the NCLEX, letter A. The patient reports drowsiness. When it comes to medications, everyone, it is not a priority, especially if the medication is expected to cause drowsiness. Okay, so drowsiness is an expected side effect as long as it doesn't change the patient's level of consciousness. Okay, now, letter C, blood pressure 110/70 is acceptable. And then letter D, the patient feels dizzy when standing, which is a common side effect of the medication. So, in letter B, the patient's respiration is 8 breaths per minute. It's abnormal. Okay. Anything below 12 is something that we need to be concerned about. And the number one complication of your diazepam is going to be respiratory depression. So that's why the rational is letter B. Okay, that's the answer. It is a life-threatening side effect of diazepam that requires urgent intervention. Since diazepam is a CNS depressant, close monitoring of respiratory function is essential. Okay, is essential. Very good. So are you ready for question number two, everybody? So good job, Cecilia, also Odette and Annie also. Thank you. Now let's go to question number two, guys. Another prioritization question for the diazepam. A nurse is reviewing medications for a patient prescribed diazepam or Valium for anxiety. Okay, which medication should be first reported to the healthcare provider? A, hydrochlorothiazide for hypertension. B, omeprazole for acid reflux. C, hydrocodone, acetaminophen for pain. Or D, metformin for diabetes. Okay, so read the question, everybody. Okay, again. So a nurse is reviewing medications for a patient prescribe diazepam, okay, diazepam or Valium for anxiety. Which medication should be reported to the healthcare provider first? A. Hydrochlorothiazide for hypertension. B. Omeprazole for acid reflux. C. Hydrocodone acetaminophen for pain. Or D. Metformin for diabetes. Okay, so give me your answer, everyone. What do you think? So this question is all about the interaction of the diazepam with other medications. So when you answer questions in the NCLEX about medications, you have to make sure that you know the interaction of the medication. So you're doing a medication review here. So what do you think will be something that you need to report to the doctor, or maybe call the pharmacy and question, if this is the right medication for the patient, especially you're giving the diazepam. Okay, so we have Gabby just came in. Hi, Gabby. Nice to see you tonight. All right, so let's see. Now, when you answer questions, everyone, okay, about drugs, you have to know the side effect of that medication. Okay, and knowing the side effect of the medication, you have to look for other drugs that may either counteract the effect of that medication or may potentiate the effect of that medication. So, do you think one of these medications may have a negative interaction with the diazepam? So, let's go to the answer, everyone. The answer for this question is going to be letter C, everybody. Letter C, hydrocodone acetaminophen. Now, why is letter C the answer? Remember, your diazepam is a CNS depressant. It is a sedative. It decreases anxiety. Now, hydrocodone is an opioid. Okay, so pain medication, which is an opioid. We don't care about acetaminophen because acetaminophen is an analgesic. Okay, but acetaminophen does not cause drowsiness. But remember, hydrocodone is an opioid, and what can happen if you're taking an opioid or hydrocodone, that will further cause decrease the patient's level of consciousness or will make the patient more drowsy. So this hydrocodone, everyone, has a potentiating effect. It's going to affect the respiration. So we need to call the pharmacy or call the doctor. Okay, clarify the order because this patient is receiving many medications already, or the diazepam and hydrocodone, which could further decrease the patient's level of consciousness. So remember this, guys. This is something that I see in the unit. We need to be very careful when we are giving medications to our patients or reviewing orders. We are not just nurses who are passing medications, we are also nurses who advocate for our patients' medications. We need to make sure that if there's any inconsistency or interaction in the medication, we need to report that to the physician. Okay? So, again, this is the rationale for that question. Hydrocodone or acetaminophen is an opioid analgesic. Remember your medications like Vicodin, guys, your brand name. Okay, they increase the risk of sedation and respiratory depression when combined with diazepam. This interaction can be dangerous and should be reported immediately. Now, you will receive questions like this in the NCLEX, wherein is going to test you if you know your drug interaction. So, guys, when you study pharma, just don't focus on the action of the medication, but you need to focus as well. What are the other medications that should not be given with this medication, especially the diazepam? You cannot give something that will make the patient more drowsy. Okay. All right. So I hope you learned something out of that. Now let's go to number 3 question, everyone. A patient with generalized anxiety disorder has been prescribed diazepam or Valium PRN. Which patient statement requires the nurse's immediate intervention? A, I only take this medication when my anxiety feels overwhelming. B, sometimes I have a glass of wine with my medication to help me relax. C, I avoid driving after taking the diazepam because it makes me sleepy. And then letter D, if I feel restless at night, I take my dose before bed. Again, let's analyze the question. A patient with generalized anxiety disorder has been prescribed diazepam or Valium PRN. Which patient statement requires the nurse's immediate intervention? A. I only take this medication when my anxiety feels overwhelming. B. Sometimes I have a glass of wine with my medication to help me relax. C. I avoid driving after taking the diazepam because it makes me sleepy. Or D. If I feel restless at night, I take my dose before bed. Now, this is a very common question in the NCLEX as well, especially when it comes to your diazepam or benzodiazepine. So remember, diazepam, guys, is a benzodiazepine medication. Okay? So after this session, any question about the diazepam, you can answer them in the NCLEX. Okay? Because we're discussing the most basic um, information that you need to know about the SFM, guys. So who got the right answer? So we have Sing Galarosa. Her answer is B. Okay. And then Cecilia also answered letter B as well. Good. And then we have Annie also answered letter B. Okay, so the answer, guys, without further ado, the answer to this question is going to be letter what? It's going to be letter B. Congratulations, everyone. Okay. So, letter B, why? Because a glass of wine can again also have a potentiating effect. It's going to cause your patient to become more drowsy when taking the medication. Okay. Now, not only wine, but you also have to think of other um of other foods or items that will make the patient drowsy as well. But number one of them will be alcohol, beer, wine, for example. That's one. Okay. So this question that you have, which patient statement requires the nurse's immediate intervention? This is a negative question. Again, I'm repeating that. This is a negative question. A negative question in the NCLEX means that you're looking for the wrong one, which is the answer. So again, I'm repeating that. This is a negative question. So be careful with negative question. Usually in the NCLEX, when you say negative question, it says requires clarification, requires reinforcement, or requires the nurse immediate intervention. So for letter A, I take this medication when my anxiety feels overwhelming. That is actually acceptable because, Valium, the patient understand that Valium has to be taken only when the anxiety is not controllable. Letter C, I avoid driving after taking the diazepam. That's correct. You're not supposed to drive because you're prone to accidents because of the dizziness. And then letter D, if I feel restless at night, I take my dose before bed. And that's exactly correct. That's the purpose of your diazepam, which is basically to control the anxiety. So the answer is letter B. Okay, so let's go to the next question, everyone. So again, this is irrational, everyone. Mixing alcohol with diazepam can cause severe CNS depression, increasing the risk of sedation, respiratory depression, and also your overdose. Now, also, this requires immediate patient education and intervention. Okay? All right. So at this point in time, let me just kind of like introduce you my book because I know that most of you probably have not heard about this yet, but I recently published my book again, the edition. So it has the NCLEX PN. So look at the book, guys, how beautiful it looks like. Okay. So I'm going to show you the actual book next time here with me, but it's really a very nice book. I'm so proud of it. It's for NCLEX RN and NCLEX PN. It's a next generation book, everyone. You can buy this in Amazon. Of course, it's also available in other online retailers. It's worldwide, everybody. So you can buy this from Barnes and Noble. You can buy this from Walmart online, Target online, and of course the book is again amazing as well. A lot of students really like it when they see the book and then when you start reading it because it's not overwhelming. It is a book that you can easily flip through the pages, and especially if you don't have enough time to review for your NCLEX. And of course, what is special about this book is really the presentation. Okay, It's really the presentation. It has a lot of tables, which make it so easy to regurgitate the information or to absorb the information. Unlike other books, wherein, of course, with other books, everybody is so thick and you get so overwhelmed. But in this book, it's just very easy to read everyone. Okay, so you can buy this in Amazon or also in our website. I'm gonna post the link later on, and I could even sign and send it to you. All right. So now let's go to the fourth question if you're all ready, everyone. So the fourth question about the diazepam or Valium. So we have 5 questions for tonight. And then we will summarize everything about the diazepam before we end for tonight. The top 10 things that you need to know about the diazepam. So nurse is administering the diazepam or Valium to a patient with anxiety. Which of the following is the most important instruction for the nurse to provide to the patient? A. You may take this medication with any type of alcohol, as it will not affect the drug's action. B. Do not stop taking this medication abruptly, as it can cause withdrawal symptoms. C. It is safe to take this medication with any over the counter sleep aid. Or D. You should take the medication only when you're feeling anxious for immediate relief. So, which one is the most important instruction to the patient? So this is health teaching now. So in the NCLEX also you will receive questions about health teaching when you're giving medications to your patient. So what do you think is the most important instruction to provide to this patient when you're giving the diazepam? Okay. Remember, everybody, pharmacology is a big part of your NCLEX test plan. Pharmacology will be there in your NCLEX. I cannot remember how many percent it is in your test plan, but it is there. And that's why you need to know your pharmacology big time, because it is a big point in your NCLEX. Like the same thing with infection control, the same thing with mental health nursing as well. It's part of the test plan. It's already determined that you will be receiving questions about pharmacology. Okay. So the answer for this question, everyone, is going to be all right, everyone. What's the answer to this question? The answer to this question, guys, is going to be of course, letter B, everyone. Okay. The most important about this medication is do not stop taking this medication abruptly, as it can cause withdrawal symptom. Guys, this is my NCLEX tip. Okay. In the NCLEX, if you don't know anything about the medication, but then the option says do not stop abruptly. A lot of these medications, antihypertensives, psychiatric medications, a lot of these medications, most of them, you don't stop abruptly. So that's your cue already. If you don't know the answer, just choose that one. Do not stop. Why? Because a lot of times, when your body is already dependent on the medication, then you may have withdrawal symptoms. Or the same thing with beta blockers. You just don't stop taking these medications because it can cause myocardial infarction or cardiovascular effects. So when you see that, do not stop, go back. Whenever you study your pharma and you see, do not stop taking the medication. You need to make sure that you take note of that. Can you give some other medications that you just don't stop suddenly? Can you give that in the comment section, guys? What are some of the other medications that you just don't stop? I know for one thing, your beta blockers, you never stop them. Okay. Also, some other medications, which are the some of the psych drugs, you don't stop suddenly as well. Okay. All right. Your anticonvulsants should not be stopped suddenly as well, because it could lead to status epilepticus. And I teach this all in the classroom as well. Okay, so hopefully you got that one right, guys. Let's go to our rationale for this question. Abruptly discontinuing the diazepam can lead to withdrawal symptoms, including anxiety, seizures, and tremors. It's important to taper the medication under a healthcare provider's guidance. So, meaning that you have to slowly decrease the amount of milligrams. SSRIs, very good. Especially long-term medications for chronic conditions, you just don't stop them suddenly. Now let's go, guys, to the last question for tonight. We're gonna have the last question, and this is all about delegation. I know that delegation is something that you're excited about. So let's see if you know anything about delegation, guys, especially when you talk about team nursing. Can someone tell me what is team nursing, everyone? What is team nursing, everybody? Because that's where your delegation comes in, especially with team nursing. So the charge nurse is assigning patients to a licensed practical nurse and a newly hired registered nurse or RN. Which patient would be most appropriate for the LPN to care for? A post-operative patient who just returned from surgery and requires frequent vital signs monitoring. B, a patient receiving IV diazepam or Valium for alcohol withdrawal requiring continuous assessment. C, a patient with chronic back pain who takes scheduled oral diazepam for muscle spasms. Or D, a patient newly admitted for seizures who requires an initial assessment. So let's read again. Okay, very important again in the NCLEX. Your delegation is one of those most important questions that you should not miss in the NCLEX. Okay. So again, the charge nurse is assigning patients to a licensed practical nurse and a newly hired registered nurse or RN. Which patient would be most appropriate for the LPN to care for? A post-operative patient who just returned from surgery and requires frequent vital signs monitoring. B, a patient receiving IV diazepam or Valium for alcohol withdrawal requiring continuous assessment. C, a patient with chronic back pain who takes scheduled oral diazepam for muscle spasms. Or D, a patient newly admitted for seizures who requires an initial assessment. Okay, so some people, okay, let's see the answer, guys. I'm going to give you the answer right now. Okay, but can someone tell me what is team nursing? I was asking that question. And then my question also is, who is the charge nurse? Right? What is a charge nurse? And then you have an RN. Okay, Odette comments. Where are you guys coming from? Are you from Florida? Are you international? Are you in the Philippines, everyone? Or Saudi Arabia? Where's your location? But anyway, when you talk about team nursing, everybody, team nursing, you could have around 8 patients, for example, and then you have one RN, and then you have one CNA, for example, and then one LVN or one LPN, for example. Okay. And some units, of course, or most units have what you call a charge nurse, everyone. Okay. So a charge nurse is somebody that leads the team or makes the assignment, but then once you are in a team nursing, everybody, you have one RN, one CNA, and then you also have one LPN. And then but it doesn't mean that if you're the RN, you cannot do what the CNA is doing. Okay. If the CNA is very busy, then everybody needs to help. Okay. But when you talk about delegation, oh, Odette is in Fresno. I'm going to be going to Fresno probably tomorrow. I'll see you. Okay. But when you're talking about delegation, everyone, it means to say that you properly assign the task to the scope of practice of your team members. Okay, so the answer to this question, guys, is going to be letter C, of course. Very good. So letter C, because your LPN can actually give oral medications. Okay, oral diazepam for muscle spasms. Now you have to remember, everybody, if it is yes, Gabby, I know you, Gabby. Okay, so you just have to remember that your LPNs cannot give IV antibiotics. Across the US, LPNs do not give IV antibiotics, but LPNs can give oral medications or injections. But you have to remember, everyone, as well. It doesn't really matter what kind of medication it is, as long as it's oral or subcutaneous or injections, LPNs can give them. Can LPNs give IV morphine? Of course, yes. No, not IV morphine, but oral morphine, for example. Anything oral. Okay. Letter A is not the answer, everyone, because letter A is an unstable patient. That patient just returned from surgery and that needs monitoring by the RN. The letter B, a patient receiving IV diazepam for alcohol withdrawal. That patient is unstable. And letter D as well, a patient newly admitted for seizures. And initial assessment is for the RN. Remember that RNs do not delegate tape. RNs do not delegate RNs do not delegate teaching, RNs do not delegate assessment, RNs do not delegate planning or evaluation. Okay, so letter C is the answer because it is the most stable patient. And this is the rational, everyone. The LPN can safely care for a stable patient with chronic pain who is receiving scheduled oral diazepam. LPNs are responsible for administering oral medications, monitoring stable patients, and providing basic care. Okay, and then A and D requires an RN because they involve unstable patients needing frequent assessment and clinical judgment. And B is also not suitable for an LPN because since IV diazepam requires continuous monitoring. So just remember your route of medication administration. So what are your top 10 NCLEX tip for diazepam? Are you ready, everyone? Okay. Your top 10 NCLEX tips for the diazepam. Things that you need to know about the diazepam, everyone. So number one, watch for respiratory depression, especially with IV use or opioids. Number two, monitor the level of consciousness. Excessive sedation may indicate toxicity. Next, avoid alcohol and CNS depressants to prevent sedation. Use caution in the elderly. Always remember, everybody, benzodiazepines, your diazepam, it can cause fall and confusion in the elderly. So be very careful about that. As much as possible, we avoid giving diazepam for the older adult population. So what I have said also, do not stop abruptly because withdrawal can occur. Number six that we need to know, or number five, is some patients, instead of becoming relaxed or calm, for example, they may have paradoxical reactions. They may become agitated. Give IV diazepam slowly to prevent hypotension. So in the NCLEX, everyone, if you don't see respiration as a respiratory depression for the diazepam, you also check the blood pressure and also the heart rate of your patient. Those are the other things that we're looking at when you have CNS depressants. For CNS or central nervous system depressants, watch out the respiration, watch out the blood pressure, and also watch out the heart rate of your patient as well. Okay, nothing to do with urinary. It has to be your blood pressure and your heart rate as well. Okay, and also avoid driving or using machinery, and also know the overdose signs. Now the question in the NCLEX is, this has been asked before, what is the antidote for your benzodiazepine? Your antidote for benzodiazepine is your flumazenil. Can somebody give me the brand name or a sample brand name for flumazenil? Flumazenil is actually found in the crash cart during a cold blue as well. It's an emergency medication. Flumazenil or Romazicon is the antidote. Okay, in our review program, I do cover all the different types of antidotes for different clinical conditions. And then this one is very important as well. Check out the AST and the ALT, or your liver function test, your AST and ALT, because your benzodiazepines or the diazepam um, are um, can cause possible hepatotoxicity because of drug buildup. Okay, so remember this top 10 tips. And then next week, of course, we're gonna have more another session which is all about drugs as well, because we need to make sure, guys, when you take your NCLEX, you know how to answer questions about pharmacology. So we do have our merchandise products, everybody. So you can go to our website and buy these products, the mask. Okay. But again, guys, thank you very much for being here tonight. Okay. And I will see you again next week. And then just wait for announcement in our Facebook page. And I hope that you learned something, guys. Make a comment. If you have any questions about our review program, you can send me a message and sign up for our email list because I'll be offering more free NCLEX review for everybody. Okay. Thank you very much, everyone. Annie, we have Sing also, and also Odette, Angelica, and then Odette. I'll see you more, everybody. Okay. Thank you, guys, and have a great night.